Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder if what we do in preschool impacts a child's whole day and even their health for years to come? Well, this new study dives deep into just that. This paper is like a blueprint for a super detailed investigation. It is not an experiment itself, but a plan to look at lots of other studies all at once. Imagine trying to figure out how to help kids move more and sit less throughout their entire day. Not just during playtime, but also when they're supposed to be resting or sleeping. That is the big puzzle these researchers want to solve. You see, for a long time, people studied things like how much kids run around and how much time they spend on screens as separate issues. But this research highlights a new way of thinking. It is all connected. Every single hour of a child's day matters, from when they wake up to when they go to bed. The World Health Organization even has guidelines for this entire 24-hour cycle, covering physical activity, sitting still, and sleep. The problem is, many kids aren't hitting these smart targets, and a huge chunk of their day is spent in early childhood education and care settings, or ECC. So naturally, researchers have been trying to create programs in these preschools and daycare centers to get kids moving more and sitting less, but the results are all over the place. Some programs seem to work, others don't, and it is hard to tell exactly why. This is where things get really interesting. The researchers here aren't just asking, did the program work? They're asking a much deeper question. Why did it work, for whom, under what situations, and how? This is the core of a realist synthesis. It's like being a detective trying to understand the whole story, not just the final outcome. They want to build a detailed program theory explaining how and why these interventions tick. So how are they planning to do this giant detective work? Well, they're going to sift through tons of existing research on programs that try to change kids' movement habits in preschools. They'll be looking at studies that focus on children aged 3 to 4 years old in SEC settings. The key is that these studies need to look at least two of the movement behaviors, like physical activity and sedentary behavior, or physical activity and sleep, not just one. And these interventions have to happen in the SEC and home. They'll be looking at studies that compare kids' behaviors before and after a program, or compare kids in a program to kids not in a program. Now, they won't just blindly accept every study. They'll use a tool to check the quality of each study, making sure the research was done well. Think of it like checking if the detective's evidence is solid. They'll look at things like how participants were chosen, if the study design was good, and if they accounted for other factors that could influence the results, known as confounders. When they dig into the studies, they won't just count numbers. They'll be paying close attention to how the researchers explained that the intervention worked or didn't work. They're looking for clues about the ingredients that make a program successful. This is where the realist part really shines. They're thinking about resources, what the intervention actually provides, like information, opportunities, or support. And they're thinking about reasoning how children and the adults around them think or feel about these resources, like their beliefs, motivation, or confidence. To help them untangle this complex web, they're going to use some established frameworks. The COMBI model looks at behavior through the lens of capability, opportunity, and motivation. The behavior change technique, BCT taxonomy, helps classify the specific strategies used in interventions. And the theory and techniques tool links these techniques to mechanisms. Together, these tools are like a structured way to understand why a change might happen. They're also acknowledging that in ESEC, adults, the practitioners, play a huge role. They can change the environment, make decisions about activities, and directly influence what children can and can't do. So, the program theory needs to account for how adult actions can create opportunities or motivations for children. The paper itself points out a challenge. The idea of looking at all 24-hour movement behaviors together is still pretty new. This means there aren't tons of programs that try to tackle all of them at once, and especially not in ECC settings for sleep. So, while this review is super important, the results will be based on the evidence that is out there right now, which might be a work in progress. This is a really smart plan to get a deeper understanding of what really makes a difference for young kids' movement habits. The biggest strength is that it is not just asking what works, but how, why, for whom, and under what circumstances. This will give us much more useful information than just knowing if a program was effective or not. It is about understanding the story of change. However, they also point out some limitations, which is a sign of good research. They're only looking at studies written in English, so they might miss important findings from other countries. They're also not including gray literature, which is like unpublished reports or conference papers, so there is a chance of missing some valuable information. And as they mentioned, there are still not a lot of studies that look at all 24-hour movement behaviors together, especially including sleep. So, we need to interpret the findings with that in mind. Ultimately, this realist synthesis aims to build a really detailed picture of how and why interventions in preschools can help children build healthy movement habits that last by understanding the interplay between the program's features, the context it is delivered in, and the underlying mechanisms. We can create much better, more targeted programs. This kind of research is crucial for making sure our youngest generation gets the best start in life, building foundations for lifelong health. So, what do you think about this approach? Does it make sense to look at a child's whole day of movement as one big thing? Let me know your thoughts in the comments below. And if you found this breakdown helpful, give it a thumbs up. Subscribe to RUBIN'S Mind Lab for more science simplified, and hit that notification bell so you don't miss our next dive into the fascinating world of psychology and behavior. Thanks for watching, and I'll see you next time.